Welcome to the award-winning Women in Healthcare Leadership podcast series brought to you by Medscape Education. Our mission is to educate, advocate, and inspire women in healthcare to lift as they rise. Each episode brings you voices of leaders who are breaking barriers and leading the way in advancing women's health. Join our global community of listeners as we hear from her. Ready to be part of the movement? Let's dive in.
Hello, I'm Sarah Thorpe, your host for today's episode of Hear From Her. Today, we're shifting the lens of our conversation from individual clinical encounters to the systems that shape them. We talk often about patient-centered care, but for women, that promise frequently breaks down once they move through fragmented pathways, disconnected service lines, and care models that weren't designed with their lived experiences in mind. In this conversation today, we'll explore what it truly means to design healthcare systems around women, not as a niche population, but as the foundation for better care, better outcomes, and stronger health systems overall. I'm pleased to share that we have two wonderful guests who are at the front lines of this work. We have Kelly Newman, creator of Experienced Messaging, president of Newman and Newman Inc. Thank you, Kelly, for joining us.
Oh, thank you, Sarah. I'm looking forward to it.
And Leah Blackwell, Vice President and Regional Chief Nursing Officer, University of Florida Health Shands Greater Gainesville. Thank you for joining us today.
Yeah, I'm excited to be here. Thanks, Sarah.
So I think this is such an important conversation for us to have. Women make up over 50% of the population. We drive the majority of healthcare decisions for our families and account for a disproportionate share of healthcare utilization. Yet many women report feeling unheard within the very systems that they're relying on. We often hear women, describing moments when something doesn't feel right, when symptoms are dismissed or care feels rushed, dots are missed, not connected. So when that experience becomes a pattern rather than rare, it raises some big questions. Is this something that you all are seeing out in the field and in your experiences?
Yeah, I can reference back to I've been a nurse for longer than I care to admit, but thinking back to my early days as a cardiac ICU nurse, um, it really became apparent to me in a particular patient who had atypical symptoms of a heart attack. She actually called her primary care doctor to share she was having jaw and what felt like tooth pain. And instead of following up on that, they sent her to the dentist. And so it was at her dentist that luckily they took a moment to really listen to her and hear her and called 911. She came to our ER and on arrival to our ER was diagnosed with having a myocardial infarction. We were able to take her for a life-saving procedure and put stents in. But it was really that moment of someone slowing down to hear what she was saying that I think really sets a good foundation for our conversation today.
Wow, that's a really powerful story. So let me ask you this. Do you see that as a failure in the design of our healthcare models right now?
So, for me, stories like that scream opportunity. So, the American Heart Association and American Lung Association have done studies that have shown, for instance, that only 44%, so that's just shy of half of American women, know that heart disease is their leading cause of death. And just 3% consider lung cancer a health risk, even though women who have never smoked are more than twice as likely to get lung cancer as men who have never smoked. So, from the marketing communications perspective that I represent, statistics like these really represent significant opportunities for achieving a market advantage from redefining the women's health experience, both in what and how a women's health center provides care.
So when we hear stories like this, what do you think it's revealing about how we are designing care and where those design choices may intentionally or unintentionally disadvantage women?
I think there's an opportunity to add three essentials from the clinical perspective, really around treating women's narratives as clinical data, making sure that we're looking at pathways that are around women's physiology and not considering them just atypical men pathways, and then coordinating interdisciplinary care around the women and their symptoms and their voice.
Yeah, I think also that I don't know if you all are familiar with this term. I only recently heard it, but bikini medicine, and it's actually a term that was coined by a cardiologist. And as you can imagine, it means solely concentrating on breasts and reproductive organs. And I think that unfortunately, we have a very narrow view of women's health. And I think we're only now just starting to see that expand. Even among professional associations, they're starting to assign a more comprehensive view of women's health. And I think even more than that, it's not just what of women's health is viewed, but even the timeline of women's health, and that it's not just about childbearing years, but the full extent or this full spectrum of a woman's health.
I think that's a really interesting perspective, that spectrum element. Right now, it feels as if the system is built around an episodic nature rather than integrating the full picture of a woman's health trajectory that often spans hormonal transitions, lived experiences, caregiving shifts, and chronic disease over decades. With that framework, how is that impacting how women interact with the healthcare system?
Yeah, for me, it's really thinking about women as the foundation of how you're going to provide care, changing your assessment, tailoring to the more female communication style, and that care coordination. And so when women are in um, caregiver relationships with their physicians, or any member of the care team, those relationships are more important than typically with men, and they want to just feel believed immediately. And so I think just providing clear, relevant explanations and experiences will allow for that seamless navigation and just build trust. Women don't lose trust because they seek information, they lose trust because we fail to provide it proactively.
Yeah, and I think a lot of it has to do with connection. And, some of that can be achieved through things like, simple eye contact and using active listening, where you're feeding back a summary of what the patient has just told you. So you're assuring them that you've heard them. But it can also mean anticipating their needs and personalizing the information you're providing. So we touched on for just a moment education, but there was a study of women's experience with healthcare provider communications done a couple of years ago. In a study of women's experience with healthcare provider communications a couple years ago, they found that only 35% of women age 40 to 64 said their healthcare provider ever talked to them about what to expect in menopause. So if I'm a patient of a women's health center, I'm not just coming in and asking you to respond to why I'm there. If it's a problem that I'm having or an annual exam that I'm needing, but are you also providing me with information that I need because of my age, for instance, and therefore I need information. You're anticipating that I need information on menopause. So connection has as much to do with substance of information and education and feeling that connection as it does, getting me in and out of an appointment efficiently.
And I think many of the threads that you're speaking to, you, Kelly, and Leah, really articulate that concept of patient-centered care that um, seems to be a core topic that the industry is talking about, putting that patient at the center, making them an active partner, individualizing their needs. But I'm curious from your perspective, when we say patient centered care, are we still missing the mark by oversimplifying the female patient's experience?
I would say yes. Women aren't men, and we can't just lump everybody into patient centered care. It's really important that we identify and recognize that they're different physiologically, communication patterns, which is going to help as you address those in your care visits and really tailor it and allow them to have better care coordination. You're really going to help build that relationship and trust. I think that empathetic communication is key, especially from a clinical perspective. It's going to enhance the history quality that the patient is giving you, treatment adherence, and really patient reported outcomes. Women generally just tend to be more verbal and subjective in how they share their symptoms. And so, really slowing down to listen to it is going to help improve clinician diagnostic skills at the end of the day.
I think also it's really important to define what exactly you mean by patient centered. Because you're right, Sarah, that's a term that's used a lot now. And I think it's used to appeal to what a healthcare organization thinks patients want. But how does your definition of patient centered differentiate you from other healthcare organizations? And what is it that you've told me that I actually experience? And are you delivering on patient expectations? And even more so, are you exceeding expectations from a competitive advantage? And that certainly involves more than, say, mauve painted walls and a butterfly in your logo. It requires operationalizing who you say you are into actionable experiences and intentionally addressing opportunities for raising the bar on women's health. So, going back to some of those statistics and issues we were talking about, if those are needs or those are missed opportunities in the community and in women's lives, then how are you intentionally in the care that your women's health center provides addressing those opportunities and translating that into not just actually experience, but even how providers are interacting with patients?
Yeah, so what I'm hearing is, feeling heard is often that difference between compliance and partnership engagement with your healthcare system and how that is really central to trust. And so, curious, where do you see women's health as an underleveraged driver of a system and differentiator within systems?
Well, I think that, one of the things, and this goes back to a little bit about what Leah was saying, is providers hear a lot about the value of empathy and making connections with patients. And when we're conducting experience messaging training sessions, I always say to physicians and to other clinicians that being told that empathy is important, I would imagine is confusing and maybe even a little insulting because you've made a choice to go into medicine. And isn't that proof that you are inherently, a feeling person? But there's a difference between, say, empathy and compassion. The definition of compassion is the desire to act on a person's behalf and ultimately to prevent the suffering that they might be experiencing. Whereas empathy is an awareness for other people's emotions and putting yourself in their shoes. So empathy doesn't require that I, as a provider, have the same experience as the patient. I don't have to have had a heart attack. I don't have to have had a C section, although that might make it our conversation more relatable. But empathy is connecting on a familiar emotion. I mean, we all know what fear feels like or frustration. And so to inject that empathetic conversation not only creates connection, but I think also for women, it encourages some of the empowerment through information and education that they really appreciate.
And Leah, as a leader in your healthcare system, how are you talking to your team about these concepts to ensure that, on a daily basis, this is translated into practice?
Well, I think it's easy for them to feel overwhelmed, like be kinder, listen more. And so I think giving them something tangible can really help, leaders translate this into clinician practice. And so, you know, we even talk about just standardizing that first and last 3 minutes of every visit. So asking what matters most, what's worrying the patient, and what the clear plan is. Women really want that concrete information and to be able to speak to the emotions of the visit. That will help create that relational continuity and move from a transactional relationship to one that's more relational and build that trust. So that's a very tangible way people can incorporate that. And it's easy and it's 90 seconds and it will help with a lot of follow-up that will need to occur, fragmentation that the patient will feel.
How do you see women's healthcare mischaracterized?
I think I think sometimes organizations think we've painted the walls pink, we have spa music playing, we have the bubbling water feature, check. We've addressed the woman's environment needs and the approach to what her expectations are. And that is really a false way of looking at it because women, as we know, are extremely strong. They've been through a lot, regardless of what age they are. They manage a lot. And I think that there is a level of respect that we can probably ante up with women's health in even how care is delivered, but certainly in how information is provided. And I think that sometimes it's characterized in a falsely fragile kind of image that I think an organization could really differentiate itself if instead there was maybe a little bit more substantive and respectful approach to how they deliver care to their women patients.
And I think that ties into what you were talking about education as well, the need for substantive information. Women are prone to seek, understand, and that comes from a space of respect that we are intelligent and we that is how we interact with the system itself. And so being provided that information throughout the patient's trajectory in the healthcare system is a great opportunity, as you said, to keep them engaged, build the rapport and trust with the patient. How does enhancing delivery of care for women impact other departments across the healthcare system?
When you provide excellent women's care, you really are increasing that loyalty and optimizing how they're going to acquire other healthcare from you. And so it does have an impact throughout your organization around other services they'll tap in to use because they value the trust that's been built along the healthcare that they've received. Um, and it really does have a financial and market share impact at the end of the day. So not only are you providing excellence to this patient population, but you're also optimizing that market share and financial outcomes.
And I'm curious too, where are we starting to see meaningful progress more at the institution level?
So there are a lot of organizations who are moving forward with women's health institutes. Um, you know, several of kind of the top leading brands like Mayo and things like that. It really is a great way to show that you're tailoring to this, patient population because it's putting everything in one location, one stop shop where you have cardiology, pulmonary, mental health, all the necessary services that really allow for that care coordination and that warm handoff between care. And it's tailored to really listening and taking those extra moments to communicate differently to the patient.
Yeah, I think that, sometimes it requires a little bit of innovative thinking. I think that if an organization doesn't have a brick and mortar, let's say, women's health center, that they can freak out thinking, oh, great, you're saying, we've got to build out this whole structure or we have to change out our infrastructure. But I think if, for instance, you apply the known quantity of multidisciplinary rounding teams the benefit of having all those different perspectives and you approach it that way so that you're putting together liaison relationships between different service lines that can broaden the scope of care that's provided to women and that's directed at their unique needs within a particular service line, then I think maybe it doesn't seem as daunting. But I think it probably begins with number one, an expanded definition of what women's health means. And then also looking at what are those unique priorities or preferences that women have in their care. I mean, we've talked a lot about education and whether a woman has a PhD or a GED, they really like information and more than men will search out medical information, particularly on the internet. So, again, in terms of how you're meeting the needs and priorities of your women patients, is your website, for instance, simply listing services that are provided, or is it a truly comprehensive, um, interactive source of women's health information that further builds that relationship with your patients and their loyalty for being long-term patients or bringing in other people. Women talk a lot about who they're seeing and why they're not seeing somebody anymore. And so the more that you are legitimately adhering to their priorities and fulfilling their interests through education, through even how education is a part of a patient visit, that gets relayed out into the marketplace.
I absolutely agree with Kelly. There's been this move nationally where in labor and delivery and after delivery that there's these additional services provided to the woman because organizations know that they drive healthcare decisions within their households. And I think it's important that we remember they do that all the time, not just after child's birth. And so doing this really does enhance that loyalty to your organization because they're continuing to make those care decisions for their whole family all the way in through their entire life to the end. And so it's important that we remember that they're still important decision makers.
I think also we would be remiss if we also didn't address the risk of losing trust, which it can be costly and difficult to repair if who you say you are is not what those patients experience. So let's suppose that a women's health center describes itself as they put patient literacy or medical literacy very high as a priority, or we are empathetic, or we're patient centered, or whatever language that is that's used to define and differentiate that center. But if I, as a patient, don't experience that, and you fall flat in that area, then you're risking my trust. You're certainly risking my patient satisfaction. So, one of the things that is very important, again, from our perspective, is that an organization hold itself accountable, and that it actively review and assess if these are the messages that characterize our women's health services. Let's look at all those patient contact points to evaluate, are we delivering on those messages? And where we're not, we need to correct that. And where are there opportunities to create experiences that augment who we say we are and how that differentiates us in the marketplace?
I think that's such an important point, the risk of losing trust. It's so hard to overcome that sense of loss. And so being very recognizing that a women-centric approach and design is not just ethical, but strategic at the systems level. So, for our listeners and as individuals on the front lines, I'm curious, what resistance have you encountered as you've tried to advance women centric approaches? And how have you overcome that resistance?
I think one thing you'll always hear from clinicians is that this adds time. We don't have time. Um, to me, really it's that 90 seconds, that empathetic listening, really undivided attention isn't that long. And, you know, those clear plans with the patient will reduce callbacks, rework, revisits. You can always start with pilots and then scale. So find a couple core physician partners who believe in this and let them do it and time themselves and see how long it takes, and then share with their colleagues and bring along the slower adopters through the process.
I think that's a great point because, of course, there's great resistance in, are you telling me something that's going to add time or add responsibilities to what I'm already being asked to do? And it's not always what you say, but how you say it. And it doesn't necessarily, that doesn't have to add time. One of my favorite Maya Angelou quotes is that people may not remember what you said, but they will never forget how you made them feel. And I think that that's particularly important with regard to patient satisfaction. But I can give you a real quick practical example of something we did working with a client where um, to they were not the patient experience was a little bit siloed between the clinical tech and the provider, which in their case were physicians and nurse practitioners. And the patient experience was very familiar, where it felt like they were two different experiences, and there wasn't any continuity in that team. And so what we did was we created what we refer to as a heads up at hands off. So where the clinic tech was already interacting with the physician or the provider and letting them know, vital signs, why the patient's there. We also capitalized on the insights that they gathered in that brief time with the patient, like are there any hearing impairment issues? Is there a family member in the room? Is that family member agitated? Is the patient agitated? Is the patient afraid? And sharing that information and those insights to really provide an advantage to the provider for when they came into the room. And it did a lot. I mean, that's just one small practical example. But that's what I mean by translating who you say you are into actual experience, it can be very practical. And to Leah's point, it doesn't necessarily mean that you're adding time or even adding pressure to what a provider is already meant to deliver.
Those are both very practical strategies, and, appreciate how appreciate the ease at which we can start adopting some of this and just take that one small step and start thinking about the female perspective and their engagement in the healthcare system. So, as we start to wrap up our conversation, I would love to hear from both of you. What do you want women and healthcare leaders to expect from the future of women's healthcare?
I want them to expect that she's believed the moment she speaks. That as providers in a care team that will believe first and clarify second. That's what I want. Women feel heard.
Yeah. And I think that, it doesn't just fall on the side of the provider. Women need to expect and act on their expectations and ask questions. And if they're not getting what they need or what they want, I mean, certainly they have that opportunity to go elsewhere in the marketplace. But, I think also being an advocate for yourself too and asking questions. You don't have to know the answers to the questions, but just asking questions like, should I be aware of this or that? Or what are some of the things that I need to be thinking about? You know, I'm not suggesting that a woman has to be her own clinician, but I'm just saying that she's got to take responsibility for her part in the relationship too.
And I think for me, if there's one takeaway from our conversation today, it's really about designing care around women isn't a special initiative. It's a smarter way to build healthcare. And that when women feel heard and understood and really supported across their lives, outcomes improve, trust is deepened, and the system itself becomes stronger. So, to our listeners from Hear From Her, as you reflect on today's conversation, I invite you to ask yourself a simple question in your own organization. Where in your system are women adapting to us instead of us adapting to them? And how can we go about changing that? What are some opportunities to pilot new ideas? Take that 90 seconds that Leah mentioned to engage deeper, more meaningfully to enhance how we deliver care for women. Thank you, Leah and Kelly, for your time today.
Thank you.
Yeah.
To our listeners around the world, thanks for joining us today. Tune in as we continue our journey to amplify the voices of women leaders in healthcare. Hear From Her is brought to you by Medscape Education. Please subscribe to Hear From Her on your preferred podcast channel and follow us on LinkedIn. Until next time, remember to lift as you rise.